Hello everybody. Today we are going to see a major subtopic on cardiology, that is cardiac enzymes. These cardiac enzymes are only released in the bloodstream in case of any myocardial damage or the myocardial cell being deprived of oxygenated blood. Due to the injury, these enzymes are being liberated into the bloodstream, and how we can diagnose whether it was an acute or chronic injury. So, coming to cardiac enzymes, some of the cardiac enzymes which is being released in the bloodstream is troponin I, troponin T, CKMB, creatinine kinase membrane bound, and you have BNP, binitrite phosphate, creatinine kinase, C reactive protein, which is usually liberated in case of any cardiac injury. So, coming to the details on the cardiological problem, especially when the patient is having myocardial infarction, we can evidently see the changes, that is the peak level as well as the plateau level or the downward level of these cardiac enzymes. So, in the x-axis, they are given starting from 0 to 10, that is 0 to 6 hours, followed by that you have the days calculation from 2 to 10. And on the y-axis, it is representing the normal range as well as the raised levels. So the normal range is being from, like you can see, there is a common green indicator which is showing the normal range, and anything above that we can call it as it is being rising twice, thrice, 4 times the normal value, 5 times the normal value. So this 0, that is day 1, or you call it as day 0, the patient is having chest pain with exact symptoms such as it is being very squeezy type of pain, radiating pain with dyspnea, or associated other symptoms such as nausea, vomiting, diaphoresis, and so on. And when you do an enzyme study, we can analyze these enzymatic changes being present. So we'll see one by one. So the first one, which is the myoglobin, which is shown in this diagram in the form of orange color. So you can see when the patient is having myocardial injury, these myoglobulins are being increased into the bloodstream and it is rising on its peak within 4 hours. That is within 2 to 3 hours you can see it is gone to the peak, that is more than 5 times the normal value, and then it is having a small decline in the bloodstream, and around in this third or fourth day it is coming to near normal. So this shows that the patient is having acute MI. And on the next diagram you can see that is the next bar which is increasing is your troponin. That is, it is not going to the peak immediately, might be on the 4th hour or on the 5th hour it's going to its maximum intensity, and then there is a small plateau down or the downward curvature, and it comes to near normal by the day of 6 or 7. And on the next you have the troponin, that is CPKMB, or you call it as the creatinine kinase, which is shown in the green bar, which is starting at 0 day or 0 hour, and it is not immediately going to the peak. It goes to the peak by the day of 2. So if you receive a patient with immediate increase of myoglobin, that shows that the patient is having only has started with a new MI. In case of a troponin, it can be an evolved MI, that is, the myocardial infarction has been occurring for the past 2 days or so, as well as in case of creatinine kinase. So this will give us a major idea on how the cardiac enzymes are being present in the bloodstream. So again I would repeat that the myoglobin will raise within less than 2 hours, and it is in peak intensity from 6 to 9 hours, and it is trying to return to normal within the second day. And then you can see the CKMB, or you call it as CPKMB, creatinine phosphokinase membrane bound, which is rising within 6 hours. It goes to the peak within 24 hours, that is within 1 day, and you can see that it is coming back to near normal within the third day. And when you take the troponin I, it is increasing within 4 hours, it goes to the peak within 12 hours, and it is there in the bloodstream for another 3 to 5 days, and where maybe on the 6th or 7th day it is coming back to near normal. And when you take the LDL level as well as the AST level, there is a peak increase in the AST within the first 2 days, and you can see even on the 5th day it is slightly decreasing. And when you take the LDH, that is a low density lipoprotein, it is very much high within the first 2 days, and it slowly reduces after starting with all the antilipids. It is going to near normal, that is on the 10th day. So this is how it gives a clear picture on how the cardiac biomarkers play a vital role to diagnose whether the patient is having myocardial infarction of acute or evolved stage. And that is all for today. So with this, I think that you all gain good knowledge on how this myocardial injury is being affected, and when these muscles are being affected, the cells are liberating these enzymes such as CPKB, troponin I, troponin T, myoglobin, and as well as LDHB is also being elevated. And you can see that it is also AST is also being elevated, and this shows how far the myocardial damage is occurring, whether it has occurred of a new origin or whether it was a very old MI, or we call it as the evolved MI. So if you have any doubts, please don't forget to put it onto the comment box. And I would like to say that please subscribe my channel and share to your friends who are in need or wanted to know more about myocardial damages, or you can also say you can refer for even all the cardiology. Thank you all, and that's all for today.